Marianne, I know in your practice you and Ed also see children.
Yes, we do.
And this morning we have Alexis with 2-year-old Oliver here. The idea of bringing a 2-year-old to the dentist is rather daunting, I'm sure, to most moms because we don't know what to expect. Could you please be kind enough to fill us in on that a little bit?
I would love to. Yeah, we like to make the first visit very easy and very non-threatening. So as you can see, we're getting Oliver just familiar with the equipment here. We've given him a mirror to play with, and he's just getting comfortable with that. And so it's not a threatening piece of equipment. And basically, we let the child kind of determine what we can and can't do on this first visit. So if he's very open and cooperative, then we'll proceed and do more. Now, if he lets us clean his teeth, we'll clean his teeth, but if all he lets us do is look at his teeth, then we may just look at his teeth today.
I think this is so smart, too, the way you have him sitting in his mom's lap, so right away he feels relaxed and confident.
Yeah, and secure, hopefully, too. He's feeling nice and safe there with Mom.
Yeah.
So what we'll usually start by doing is, hey, Oliver, hi, can I see that mirror? Look, you see that mirror? I use that to look at your teeth. Can I look at your teeth? Can you open big?
Where's your teeth, Oliver?
Oh.
Good job.
So we'll just let him get comfortable with having something in his mouth, Valerie.
He's a great patient.
Yes, he is. Because at this age, this is a very foreign concept to them to have something in their mouth. So we don't want to force it. We don't want to be traumatized in any way. So we'll just keep it really easy. So we'll show them all the things we have. So Oliver, hey, you want to see my toothbrush? You see that? This is my special electric toothbrush. Watch. I can make it spin. You see that? You want to touch it?
Go ahead, honey. You can
Let's put the mirror down. Give me your finger. And it will tickle your finger.
Blowing a little air.
A little bit, yeah. And it's spinning, so it kind of tickles.
Does
that tickle?
Is that funny?
You can put that in your mouth, and we could tickle your tooth. You want to tickle a tooth? Here, watch. You can hold it. You hold it, and you can put it in your mouth.
There you go. Good job.
So the whole idea is just let him have some control, because at this age, control is real important. And you can see how he's kind of having fun with that.
Yeah.
And we may not get a whole lot done, but we're setting kind of the foundation for good appointments in the future.
Laying great groundwork.
Yeah.
Because children are used to going to the pediatrician from the time they're infants, but not the dentist until they get to be, I don't know, what would be the ideal age to take a child for the first time?
Well, ideally, I think once they start getting a fair amount of teeth in their mouths, 2 is probably about as young
so
as we
about
could
this
hope.
age,
Yeah, about this age is ideal. Now, not every 2-year-old will be ready, but sometimes if they're not quite ready, the parent can bring them in with them when the parent's getting their teeth cleaned.
Yes, you were talking earlier about letting the child come in with you when you're having something very non-threatening done, like getting your teeth cleaned.
Exactly.
And they can just watch you and see how relaxed and pain-free it is for you, and nothing scary and all of that.
And it's non-threatening for them because it's not their appointment, so they're feeling very comfortable in the office usually with that. So
that's a great idea for the first time.
And we can give them a ride in the chair so that they get familiar with the equipment that way. And then usually the subsequent visit, they're more open and they're ready to let us do more. So maybe if the first visit doesn't allow, we might actually get their teeth cleaned in the second visit. You want to sit up? We can sit up.
And their natural curiosity really kicks in too, all this interesting new stuff to investigate and play with.
Right, and that's the whole thing. We want to make it kind of a fun place for them to come. And just always within wherever they're at, maturity-wise, because they'll all be different that way.
Yes.
And see now he's getting a little impatient, so we wouldn't force him to stay in.
Right.
So we could let him just kind of go at this point, because he did really well. I mean, we did a lot today, and this is good for what a 2-year-old could probably put up with the first visit.
You did good, honey.
Good job. Goes up and down.